I think that the news media for something like HIV testing or HIV prevention probably plays a relatively small role. And the reason I say that is because news media need news. And so if there's a new development in the world of testing, if there's a new recommendation, and there's an announcement tied to that, there's something that raises the level of news, then you're going to get perhaps a lot of attention. One of the primary ways to get people to follow a recommendation is often their healthcare provider. And so healthcare providers are probably one of the primary sources for recommendations and getting people to comply with HIV testing. Another thing can be advocacy groups and advocacy organizations. They can be a great way to reach people in the community before they even get to a doctor or a healthcare provider, as well as a great way to encourage people to see a healthcare provider where they can have those kinds of conversations. Yeah, when it comes to HIV testing, there's a couple of things that come into play. One, you probably need to reach people who are in at-risk populations before they get to a healthcare provider, and to encourage them to talk to a healthcare provider. Many people still may not talk to a healthcare provider, at least proactively. So you also have to equip healthcare providers with the resources they need to, one, identify which patients they need to have a priority on when it comes for HIV testing, and also how to have those conversations. And so that's another thing that often happens, is that you have to be able to have effective conversations, and you can't necessarily assume that healthcare providers, whether they're doctors or nurses, know how to have good conversations about something like HIV testing.